Good morning to everyone. I'm going to share my screen. Just 1 second. So once again, my name is MANUEL Pereira. I'm a public health medical specialist, and I am the board member and chief medical officer of HopeCare. HopeCare is a Portuguese company that developed a remote patient monitoring solution. And the concept that we have is the concept that healthcare can be provided with the patient at home. So the concept that we have is to have a solution that provides us the hospital at home concept. The ideal is to integrate different types of data in order for us to monitor the patient remotely and only get interventions clinically when it is in fact necessary. In order for us to provide our services, we have the necessity to certify the solution as a medical device. So in 2023...
Sorry, Manuel, sorry, do you have, I was just wondering, there's a lot of background noise. I wonder if you have...
I'm going to try to slow it down. Just give me 1 second.
A different speaker or...
Yeah, I think it should be. And now, are you listening me better without too many?
A little bit better, yes, maybe. Yes, try. Thank you.
Okay. So as I was saying, the HopeCare solution, it was certified as a Class 2B medical device in 2023. So we are able to perform the monitorization of the patients at home with a software that allows us to integrate different types of data and stratify risk of the patients according to the vital signs that they have. With the concept that we have developed and implementing pilots in several hospitals between 2015 and 2017, we get several results regarding healthcare consumption. So we got reductions in healthcare consumptions in about 55% in hospital readmissions, in emergency department visits, and hospital stays durations. So in fact, we can use our solution to improve results in the side of healthcare consumptions, but also with the improvement of patient clinical outcomes. This was possible because the solution is implemented together with the teams in the hospitals. So our solution is implemented together with them, and I'm going to explain a little bit better how the solution works. So the concept of remote patient monitoring solution for HopeCare starts with the definition of the clinical protocol to be implemented. So this discussion is made by the clinical teams in the hospital and the clinical team of HopeCare. And we are going to define the inclusion criteria of the patients. So which type of patients we are going to monitor, which vital signs and health data we are going to collect, the risk of stratification for each parameter and each vital sign that we are going to provide in the solution, and also the devices that we are going to connect to the patient to be monitored at home. With that, the doctor in the hospital can start to prescribe the solution to the patient. So the patient with the prescription get access to an app that he can have on his cell phone and allow us to connect different types of devices. These types of devices, these data sources, will be aligned with the definition of the clinical protocol. So it was the minimum number of devices for us to completely monitor the patient at home. It can be Class 3 medical devices, like implantable cardiac devices, other medical devices like a thermometer, a pulse oximeter, or a blood pressure machine, and also wearables for live data, just like physical activity or nutrition. These data are integrated in HopeCare solution, and through an API, it goes to our databases, and it's where the algorithm of risk stratification starts to work. This algorithm, the first algorithm that we are developed, is certified as a Class 2B medical device for EUMDR and for UKCA. And this stratification allows us to only take the real necessity of clinical intervention for nurses and doctors for the triage team according to a risk stratification process. So the 5 levels of alerts are given to the clinical teams, and they can answer only to the clinical situation that they really need clinical intervention. This in the first line by the triage team, and in the second line by the medical team. Why I bring this slide to here? Because as we have different types of data, and this solution has been certified as a medical device, we are always looking for new concepts and new types of data that we can integrate in the solution. So with this, we bring the health surveys. The health surveys are another important information, and why we bring that? Because as explained before by Professor Bart, the clinical decision is not made only by remote patient monitoring data and bioviral signs. They are making also by signs and symptoms. They are made by quality of life. They are also made by another types of evaluation that can be performed through health surveys. And in our conversations and discussions with the clinical teams, they found it quite interesting to have new algorithms of risk stratification that allow us to integrate the health surveys with the remote patient monitoring data. And it was the concept of to start this application for the first phase of the TEF. It was to create a new algorithm that integrates these all types of data in a new risk stratification model, integrating the health surveys. But for that, we needed the right partner. And the right partner, it was, in our experience, Coimbra. Coimbra is one public hospital in Portugal, yes, Coimbra, which has the possibility to integrate this type of projects. And we have the clinical teams aligned with the solution of Hope Care. So in the pneumology and cardiology side, they feel the need to have this all information integrated in the new risk stratification algorithms that we can produce and we can develop with clinical research. So with this all alignment between Hope Care, Coimbra, and Instituto Pedro Nunes, we created our application for the TEF in order for us to create this new algorithm. For us, Hope Care, it is a new product. So it needs all the whole process of the certification of the solution again. So the solution as we have is not compliant with all the things that we can, with the new things that we will apply. But with this, we need to apply for a new product. And for this, we're going to integrate the health surveys and the remote patient monitoring data in the new risk stratification models for COPD and heart failure. So what we are testing now is that the machine learning algorithms that integrate different types of remote patient monitoring data that allow us to stratify new risk models for evaluating the patients and to improve the clinical decision in the hospitals. For this to work, it was very important to have the clinical teams aligned. It was the first step. Even before the application, it was to have the whole teams aligned for us to go for this application and to improve the submission and the implementation of the project. And the vision, of course, is to have better outcomes for the patient. So to avoid him to have decompensations and healthcare deterioration, providing to the healthcare teams the adequate resources for them to intervene in a more preventive way, and to improve clinical benefits for the patients and for their quality of life. For this, it was important to have a roadmap. So we have a project management side that allows us to fulfill all the parts of the project. We have to submit our research protocol for us to have our clinical studies validated and approved by ethical commission. We have made that process in Coimbra. We identified the patients and the site to implement. So it is Coimbra and these two pathologies. And the third part is to have the patients involved, recruited, and to start collecting data. That's the next step that we are going to develop. With this, we're going to train the first model of the machine learning new risk stratification models that we are going to develop. And after that, we're going to retrain the model with more data in order for us to have a training and retraining of the model. We are going to reanalyze it again, and we're going to disseminate the results and have the publication. With the publication of the studies, we're also going to have the new application for a new certified product, and also to fulfill all the requirements for UMDR and UKCA in order for us to have this solution implemented in the HC Alert in the Hope Care solution. So this collaboration, it was important in order for us to have the possibility to test and retest this algorithm with real patients, in a real environment. It allows us to improve the TRL of this new solution because it is new compared to the other one. So it's something that we need to improve in a real environment. It is also important for us to have the interoperability and integration of our healthcare solution with the hospital, because avoid us to duplicate the work of the healthcare professionals in the hospital. So Coimbra provides us also this opportunity as well. And finally, one of the most important things is to develop clinical research with the scientific evidence that we can collect during this project and improve patients' clinical outcomes. Naturally, this has challenge, of course. The ethical and legal approvals takes their time, and it can in fact be a bottleneck in the project. Another thing that is important, it was to have the clinical teams on board, to have the communication between doctors. It was important, but we must never forget that we are implementing a solution with the teams that are with a huge workload from their side. So this should be very carefully negotiated with them. The patient's recruitment and engagement is also important because we need to collect data and to have the patients onboarded with the solution. So they need to understand if this type of solution can improve, effect their results, and if they are compliant with the monetization that we need. And last but not the least, in the business perspective, to scale up the solution and to offer these new products in different environments. So, finally, I must say that this has been a good experience until today. It provides us all the requirements that we need and all the resources that we need in order for us to develop new products in a certified solution. And in the future, we should continue with this collaboration together with TEF. Thank you.
Thank you so much, Manuel. Really great to hear about your experience and your journey and how it continues as well. Can I just ask you a question, because I was intrigued when you talked about the how to get the clinicians in line, and how difficult was it to align with these? Did they have different opinions about the solution, or were they quite aligned with what they need and what they would have liked from it?
Thank you for the question, and it is very important. Well, mainly the first concept, it is to understand these type of solutions can improve their workload. But in the beginning, it's more workload for them. So the first concern that they have in Portugal is, okay, I am full of work today, and you're going to give me some more work to do. That's the first part. That's the first challenge. But when they start to see the results and to see that I don't need to see the patient every single day, I can look at the patient only when they need, we're starting to have more engagement from their side.
Yeah.
And in health, it's like a trigger. It's someone says it is good, the other ones normally go around and say, yes, okay, I can work with that, and then I can test it. Another thing that is important is the clinical side also have in the beginning the belief that these type of solutions can work. If you find this type of people, normally the implementation went well. If you found someone that is going to have some questions or too many concerns with the solution, it can be a very big bottleneck, because we need data from the patients, we need the patients to be onboarded. And if the clinical teams are not aligned from the beginning, it takes too much time and takes too much difficulties to implement the project.
Yeah. Okay, thank you.